too, so it's not like big deal.
Okay.
Okay. Well, thank you for joining me this morning, Kylie. I want to start off first. If you could kind of introduce yourself, introduce who you are, what you are currently doing, and how this relates to kind of what we're talking about today.
Okay, yeah. So my name is Kylie Richter. I am currently a master's student at Abilene Christian University in Abilene, Texas, and I'm working on my master's in clinical psychology. I will graduate in May and then apply for licensure. And up until this point, I've been able to see patients and work with them in the mental health profession. And I've worked with patients all the way from a 6-year-old up into like a 63-year-old. And so I've seen a wide variety of patients. I see them at our school clinic that we have. So students and even people in the community can come in and receive mental health services. And then I've also helped people out in the community through organizations that we have here in town that help serve impoverished patients or people who have no income really or no insurance, and so things like that.
Perfect. So working on the college campus, I know you deal with people who also aren't in that demographics, but it's also a time of high stress for people, and all my students are currently in that stage of life, and so I think it's something that they really can get some help and guidance for them to help some of their friends and colleagues too. So what do you think the biggest emotional and social well-being issue is amongst current college students?
I would definitely have to say anxiety and depression. A lot of times, especially for freshmen coming in, this is their first time away from home. They're getting to make pretty much all the decisions for their life right now. And so being away from home and in this new environment can cause an increase in stress, but also it can cause a decrease in the way a person's feeling as they're away from home. They might miss their family. They might not feel like they're fitting in. They don't really have a sense of community. And so all these factors play into that, into where a lot of people well, not a lot, but I would say depression and anxiety are the highest.
Oh, sorry.
No, you're fine. Go ahead.
How do you think, we're going to talk a little bit about like ways to take care of yourself, but what are some negative ways that people demonstrate these stresses? So I think a lot of times with depression and anxiety, some people don't see it in themselves, but can see it in other people. Maybe what are some ways that that's demonstrated in college students, or things we should look for within our friends to be concerned about or within ourselves?
Yeah, so a lot of times people try to serve other people, and this goes into the health profession as well. We get into this profession because we want to help people, whether it be psychology or athletic training or doctors, physicians, anything like that. And so we put this focus on helping others, and we neglect to look at ourselves and see when we're not feeling the best emotionally, mentally, physically. And so a lot of times this can play into trying to please your friends or trying to please certain groups, putting a lot of effort into your schoolwork if someone is highly academic motivated. And so just making sure we take a step back and are aware, like, is my body fatigued? Is my mind mentally fatigued? Do I need to take a break from spending so much time with people? And so just being able to take a step back and looking at ourselves and making sure we're not overexerting ourselves.
I think, and maybe you can correct me if I'm wrong, I think it's fair to say that most college students have had a point in their career or up to this point, that they have had a sort of anxiety or depression that maybe isn't something that's been diagnosed, but that they've gone through a tough time, that they would exhibit these signs and symptoms.
Oh, most definitely. And anxiety can be anything as little as you're nervous before a test to where you might have a full-blown panic attack. So there's a wide range of anxiety, but no matter how, if you're on the low end of the spectrum or the high end of the spectrum, there's no shame in seeking help for that.
And I think that's the key, and that's one thing I wanted to talk with someone who is in the profession too, and get the students to have some idea that it's okay. And we'll talk about that in here a little bit. If you're going through these stressors, what are ways to take care of yourself? And you mentioned maybe getting away from people for a little bit, so that can work if it's social. What are some other ways to maybe take care of yourself mentally, like test preparation or any other sort of the things that you've mentioned earlier?
Yeah, so relaxation is a big thing that can really have an impact on our lives. And so with relaxation, you have like deep breathing techniques. You can do mindfulness activities. So mindfulness, when I say that, I mean you can listen to scripts where it kind of just relaxes your mind and you focus only on what the video is saying. And so those are really beneficial. And doing things that you love. And so when I say like taking time for yourself and taking a step back, if you're someone who loves to read, make sure you set a time to read a book. Or if you're someone who really likes to go work out, make sure you set aside time to go work out. And so, but back with the breathing exercises, it's been shown that if someone deep breathes 3 times a day, they're likely to have reduced stress in their life than opposed to someone who doesn't. And so just by deep breathing, it's something as simple as just taking a deep breath in, holding it, and then releasing it, and doing that 3 times a day. And so that's something that's really easy and doesn't take a lot of effort. And then with the mindfulness activities, just going in on YouTube and saying mindfulness exercise and just listening to that video. So I think those are big ways that can help if you start to feel those things coming on. And then even seeking out professional help if you feel that you need some assistance with that. There's no shame in seeking out help. Just as someone who has an injury or has a broken arm, they're going to go to the doctor to get help, or if they have the flu. And so I think it's important for people to remember that even though we can't physically see our mind, what's going on inside of there sometimes might need help, just as like a broken arm or the flu would.
Yeah, and that negative stigma, I think, has been there, especially for a long time. I know especially like high school or when I was in college, not that it was that long ago, but people didn't talk about their mental health. People didn't, it was like a shameful thing to say that you had gone to see a counselor. But I think we're seeing a little bit of a positive trend in the shift of this, that mental health awareness is becoming something that people are willing to talk about. And I know that a few of the students in my class have openly talked about me about it and some reflections. And I think it's a great time of being vulnerable and saying like, hey, it's okay to include your friends in these to seek out the help. Here at Indiana State, we have services available for all the students, and it's only $30 a semester for services as often as they need. So there's a tremendous opportunity that our students could seek this out. In which ways, I know we talked a little bit about, there was a professional athlete here in the Olympics that talked about mental health, and I think that's a big way of promoting this change for the good. Can you talk a little bit about that or some other ways that we've seen this trend of being open and vulnerable with your mental health?
Yeah, definitely. So Michaela, I think she was a slalom skier, but she talked about in an interview how before races she would get very nervous and very anxious and would actually throw up. And so this is common for people in sports psychology, in sports, as they have this big performance that they're trying to achieve or perform. And then they get very anxious about the pressures of impressing people, of making sure they do their best, of not letting anyone down. And so this anxiety builds up inside of them to where it can happen in an outwardly expression, such as throwing up. And so she talks about in her interview how she worked with a sports psychologist to kind of help calm her nerves down before races to where she doesn't throw up. And so just hearing someone at such a high level of sports being able to sorry, I can't think of the word, but
handle and be able to be vulnerable and outspoken about their mental health.
Just being to advocate. That's what I was looking for. So being to advocate for psychology and for seeing a mental health professional, that's a huge deal, and it helps break down some of those walls. And so I would just encourage people who have seen a mental health professional, if they feel comfortable, just being an advocate and saying, you know what, there's nothing wrong with going to see a therapist. A lot of people think back to things that they see in movies or on TV, or even just back in the old days, someone just laying down on a couch talking about their feelings. But today, therapy has advanced so much, and we work with patients on different things and how to really improve their lives. And so while talking is very important, and I think it helps, there's also ways that we actually do like behavioral things or work with the mind that way to kind of help promote good well-being.
So advocating is one way. How else can we promote mental health and well-being? Maybe within our friends, within our social groups. What are some ways that we can promote this well-being?
Yeah, so a big one is, and I'm sure you hear this all the time, is getting a good amount of sleep, eating well, and exercising. So these are the 3 biggest proponents, I think, to healthy well-being. So making sure we get enough sleep. I know it is hard in college to get a good 8 hours of sleep, whether it be in the dorm because someone's being too loud or we're staying up studying for tests. but trying to get a good 8 hours of sleep can really have an effect on a person. And so our body needs that rest. And so as we had mentioned kind of throughout this interview, we need to take a step back and take care of our bodies. And so making sure we get the proper rest, letting our body rejuvenate from all the energy that we're exerting. And eating, that is a big one. So what we put into our bodies is what fuels us. And so we want to make sure that we're eating healthy and eating good proportions and keeping up with our meals. And so a lot of times in college, students skip out on breakfast because they want to wake up as late as possible to go to class. But making sure we start our days right by feeding our bodies something that can energize us for the day, that can have a huge effect on things as well. And then lastly, like I said, exercise. And so I'm sure being in athletic training, y'all know this, but when you exercise, it releases some hormones in your brain that help regulate your like stress and anxiety and just your kind of mental hormones that control your level of stress and things like that. And so being able to exercise will help relieve some stress. It'll maybe relieve some anger, and it can really help boost your energy if you're feeling kind of down or sad.
Thank you so much, Kylie. So I'm going to shift gears a little bit here. We've talked a lot about how to take care of people within more of a peer-to-peer role. And I think that's very important for the students who are, currently going through this. And all the students are going to be prepared to become healthcare providers. And so as a healthcare provider, it's something, and too, it's a taxing job. Like, I wouldn't trade what I do for the world. But especially when events happen, or after dealing with an emotional patient, it takes a lot out on you too. And so we've talked about healthcare teams and interprofessional education, and so how we need various healthcare providers to work together. And I think that one of the most common people who get forgotten are the counselors or psychologists within that. We think a lot of times, because we don't see the emotions, we don't see the issues that are going on, we kind of forget that. So we take care of athletic training or physical therapy or physicians, and we forget sometimes the most important person to get through an injury, an illness, or even a death. Can you talk a little about this importance of having a counselor or a psychologist available that you work with, being familiar with them as a healthcare provider so you can consult on patient care, and just the importance of counseling for our patients that we see?
Yeah, definitely. And so within sports psychology and with athletic trainers, I think there is a big connection there that a psychologist can play into. And so when you have an athlete, especially at the collegiate or even like Olympian level, they have worked their whole entire life for this sport. They have practiced endless hours. They have put in endless effort. They have watched endless video footage. And so their whole life and identity has been consumed with this sport. And so when an injury takes place that sets them back in their performance or even to achieving their goals, this can have a huge toll on them mentally. And so it's as if someone had been working their whole life to do this thing, and now it's taken away from them in an instant. And so being able to process what to do next and how to go on from there, that's really hard for a person to go through by themselves. And so they may have thoughts about letting people down, never being good as good as they were, not being good enough, losing their spot on the team. So all these things are running through their head. And a lot of times just being able to verbalize that with someone like a counselor, just letting them know that these are the fears that are going through their mind, that can be really helpful. And then additionally, having the psychologist work with them and help them understand like their identity is not in their sport. They are worth so much more than being a soccer player, being a volleyball player. Just being able to work through those emotions that they're feeling in this moment. And then also, along with kind of like we talked about with Michaela, the skier, a lot of people who come back from an injury, they're nervous that they're not going to be able to perform as well as they did. And so being able to work on things like reducing your breathing to where you can have more calm breaths, to doing some mindfulness activities, different things like that to help calm the person down when they're nervous about getting started again.
I think that's a key that you talked about too, the identity, and whether it is within sport or within maybe you were on student government or anything that defined you. A lot of times I feel like college students stick to one thing and that's who they are. And when that phase in their life changes, whether it be due to an injury, whether it be due to graduation, a lot of times people aren't able to handle it. And especially if things are stripped out quickly. So you mentioned injuries. So career-ending injuries, I think, are one of the biggest things that I notice it within as an athletic trainer is having a person whose whole life has revolved around being with their team, being with their coaches, to where they now cannot participate in something that they love and something that defines them. They now go from being like the star on campus to maybe the injured person that everyone feels pity for. And it's a very hard thing to deal with. And as an athletic trainer, I have a little bit of guidance in how to treat them and how to help them get through. But that's when I like to refer to somebody else who has even greater knowledge than me, because like I said, I only have a little bit of training and your whole training is in this. So I think that's a fantastic point that you've made there, Kylie. Within athletic training, we talked a lot about how it's taxing within athletic training physicians, even for counselors themselves, that if you are going through something where patients have either passed away, are going through a traumatic experience, are very ill, or are dealing with things. Unfortunately, we've had a lot of things coming up in the news about like shootings and school issues. And I think this is a time that healthcare providers extend themselves like a ton, but we don't necessarily seek the help that we need. Can you talk a little about the role of a counselor for healthcare providers or even for other counselors at that to help them get through these difficult times?
Yeah, definitely. And so kind of like we touched on before, and as you mentioned, we are in a profession because we want to help people, whether it be helping them mentally, helping them physically, helping them emotionally, whatever it may be. We're in a profession where we want to help people. And so a lot of times we are so focused on helping others that we neglect ourselves. And so making sure we're aware of kind of how we're feeling. And so with athletic training, if you have a patient who is not getting better and they're getting so frustrated and they're taking it out on you, that's a lot to deal with. And so being able to go talk to someone about what's going on in your work life, that can really take some stress off. We have these thoughts, but once we verbalize them, we hear what they are, and that can do wonders for someone. Just being able to talk about what's going on in their work and their life, just in general. And also, when you're working and helping with people, it can take a lot out of you to where you get burnt out. You're putting so much energy and so much effort into your work that you have neglected yourself for so long that you're not finding your work enjoyable anymore. And so being able to not get to that point, going and talking with someone can assist in that. It can help reduce those feelings of burnout and just being able to work through the emotions that you're feeling.
Within athletic training specifically, they started this thing about a year ago when they started the training. It's called AT's Care. And it's where counselors will come and will train athletic trainers. And so we have a handful of people across the profession that are trained for emergency situations, especially if you've had the passing of one of your patients. And so I think it's a fantastic way, too, of that interprofessional collaboration where the counselors are there, but there's also athletic trainers there. So you're in a unique situation, Kylie, that you fully understand athletic training from our relationship, from your sports career. But unfortunately, some people don't have that sports medicine background too. And so having somebody work together, but also having somebody there who truly understands what they're going through, but maybe can't provide all that help, it's a fantastic service that's there. And so if any of my students eventually get into athletic training, it's something that they can take a part of and join and help each other. And more than, oh, I feel sorry for you, I'm here, but truly being able to help during that time of need. So,
yeah. I think it's important for us health professionals to kind of advocate for each other. So just as if I were to see someone who had an injury, I would encourage them to go see an athletic trainer or a doctor. And so if y'all see someone who is suffering from something mentally or emotionally, just encouraging them to go seek out a mental health professional.
And I think just lastly, I think it's important to know when an emergency report should occur, whether that be for a patient, a friend, anything like that. What are some signs and symptoms that we as either healthcare professionals or within our peers need to look out for, that we need to seek emergency care for a healthcare provider rather than maybe waiting for a day or two and getting them in to see somebody at a regular scheduled appointment?
Yeah, I think definitely being in the athletic training room, you get to see a unique part of your patients. This is when they're kind of at their most vulnerable. And you know these patients, you work with them constantly. And so just being able to pick up when there's a shift in their attitude and when there's a shift in their demeanor. And so everyone can have a bad day. That's not uncommon. But when you notice, like for a couple days consecutively, that they have a lack of interest, they have a lack of pleasure in activities that once made them happy or excited. If you see a patient who is not eating very well, or who seems fatigued a lot more than they usually are after practice, or if they're fatigued before practice, just being able to watch out for the signs that are for depression, because when people get severely depressed, often suicide is a thought. And so if you notice anything going on that's not normal in your patients or in your athletes, just being able to be aware and just ask them if they're okay. I think that's a big thing that people are scared to do, but can be so important and can really save a life. If you see someone who's having a bad day, or if they have not been themselves, a simple question of, hey, are you okay? Or is there anything going on? Just being able to ask them, because chances are no one has asked them if they're okay or if what's going on. And this gives them an opportunity to talk to you. And if you feel that what they're talking to you about is above your level or is something that you're not comfortable dealing with, then that's when you can go seek out a mental health professional.
Well, thank you so much, Kylie, for taking some time today. We really appreciate your expertise and everything that you brought to this conversation. So thank you so much for taking some time to talk to us.
Of course. Thank you for having me.